Hi, my name is Laura Gonzalez, and I am currently the Vice President of Clinical Learning Resources at Sentinel U. So I'd like to start with a little bit of background. I have been a nurse for over 30 years. I was trained as an emergency department nurse where I worked for many years before deciding to become an advanced nurse practitioner, or an NP. I practiced in that field and ultimately decided to enter the field of academia, being urged by a previous instructor. And so I spent the last 20 years in academia. And most recently, I have moved over to the corporate setting, which is something very unique and different from me. And I am now currently developing nursing simulations and healthcare learning innovations. Absolutely. So, Sentinel U is a corporation, a company that delivers a full portfolio of healthcare simulations that have been created and crafted to reflect real world situations for today's nurses. So, just some background, simulation has been around for many years, primarily in aviation industry. And simulation in nursing and healthcare has been around in earnest for about the last 15 to 20 years. Now, in that time, it has been primarily mannequin based or task trainer based, what we refer to kind of maybe high fidelity or low fidelity. And that means that the nursing learners would enter the simulation lab or the simulation center, and they would engage with mannequins, if you will, that looked extremely realistic, and they would be immersed in a particular case or scenario. Now, within the last 5 years, we have moved to a different type of simulation delivery, if you will. We recognize that screen based or 2D animated simulations are a very powerful adjunct to that learning process. So then, therefore, Sentinel U is creating content in a 2D virtual environment where learners can approach a particular case scenario or patient encounter very realistic and apply clinical judgment skills and really improve those learning outcomes. So the Sentinel U portfolio is very robust, excuse me. It has a wide breadth and depth of content. So if you think about, you can approach it in two ways. You can approach it in terms of content across the lifespan, or you could look at it in terms of what is covered in most traditional nursing curriculums, where we start out with care of the adult medical patient, care of the adult surgical patient, perhaps moving into advanced medical surgical care. That is particularly prioritization of care. And when we talk about prioritization of care, it's probably one of the most basic concepts in nursing education, and that is really where new nurses or novice nurses struggle. It's the ability to link that critical thinking and clinical decision making as it relates to prioritization of care. So that is very important as a nursing learner. Understanding how to prioritize care can really impact those patient outcomes, if you will. So our prioritization of care products, specifically the specialty series, to your point, covers not only adult medical and adult medical surgical, but we also include content, geriatric content, so care of the older adult, mental health content, which I think universally we are seeing such an increase in the need for mental health awareness. So this really positions the patient, it positions the student in the opportunity to learn more about those mental health patient presentations that, by the way, don't necessarily occur on a medical surgical unit, but can occur in the outpatient clinic setting, can occur in the pediatric environment, can occur in the OB environment. Of course, we see them in the mental health environment. And then we also have maternal child health. Now, one thing, at least in the United States, we have seen a real loss and lack of clinical placement. It is very difficult for nursing students that are doing their OB maternal health rotations to get into a clinical setting. And that's for many reasons. That is even before the pandemic. So being able to enhance and kind of build up your maternal health child curriculum using our products is really very useful. So you're really able to work in all of those specialty areas to build that prioritization of care skill. Now, we also have some very unique topics that are, we believe, are unique to Sentinel U. The first and foremost I would mention is interprofessional training. So internationally, there's a huge initiative that all healthcare education and healthcare learners, including nurses, participate in what we refer to as interprofessional education, or IPE, right? Um, but unfortunately, opportunities to have interprofessional education or IPE training are often limited. There are often many barriers to bringing together diverse types of students, right, from different types of specialties. Just imagine if you had the ideal healthcare school where you had nursing, physical therapy, medicine, pharmacy, radiology. That is not That's not what we have encountered lately. We have very distinct schools: School of Nursing, School of Physical Therapy. So opportunities are not, they do not abound. So how do we afford our students, our nursing students who really need this training, how are we going to help them achieve those competencies? So the interprofessional module, or simulation, I should say, follows the nurse, it's her point of view, to care for a patient across the lifespan, beginning with the care of a young girl, right? And in this environment, the learner, the nursing student, the nursing learner, is tasked with creating a healthcare team. So they're required to identify who would be best to be on this interprofessional team to carry out the patient care outcomes for this young girl in this instance. So during the simulation, the nurse learner is asked to identify team members such as a social worker, a physical therapist, a pharmacist, a respiratory therapist. And if you've ever worked in an interprofessional environment, there are some challenges. And so in this simulation, you have to kind of mitigate and overcome barriers to communication, understand how to plan accordingly, really develop a shared mental model, if you will, with the other members in this virtual environment. And it's an incredibly unique product. And so the nurse gets to care for this patient as a child, as a young adult, and then after when she's pregnant. So not only do you see this interprofessional team dynamics change across the span of the product, but you also get to see this one patient kind of across the continuum, if you will. Now, another unique product that Sentinel U offers is what we refer to as telehealth, our telehealth series. Now, I think it's pretty evident that no time than right now have we seen such a surge in telehealth medicine or telehealth care. This is a special type of healthcare with very, very specific nuances and competencies. So our telehealth simulations include medical surgical, geriatrics, mental health, pediatrics, and maternal child health. So you as the nurse, right, you encounter the patient in the hospital setting, the inpatient setting. And while you're with the patient planning for discharge, that really important discharge planning, you're educating them on the use of telehealth. You need to kind of help your patient understand that their follow-up care is going to take place in the telehealth environment. So I don't know about you, Plamena, if you've ever had a telehealth encounter with your provider, but there are certainly some things that have to be in place. So while the learner is explaining this, they're also being queried on telehealth competencies and making some decisions in terms of what technology is necessary for this encounter, such as, will I need to monitor the patient's glucose? Will I need to do ECG monitoring? Will I need to be able to weigh the patient? For example, now I don't want to get too technical, but let's say you have a patient who has something very common, unfortunately, such as congestive heart failure. You send this patient home, and one of the things we want to monitor with a patient with congestive heart failure would be, how much does the patient weigh? Their daily weights are super important. So think about the technology that I'm able to place the patient can step onto the scale, and immediately that data is sent to the nurse who's monitoring them during this telehealth visit. So they're getting some feedback from the patient from the comfort of the patient's home. So then the nurse learner must make some clinical decisions based on the data. So all of this is kind of put together in a very immersive, experiential simulation. The simulation also helps them understand the legal consequences of telehealth nursing and telehealth medicine. It's a very unique product that I think is super valuable, especially in today's world. We're seeing a lot more of telehealth visits. So as I mentioned previously, the Sentinel U portfolio is very robust, and we're really able to provide solutions to not only unlicensed professionals or pre-licensure, but also for those licensed nurses and those postgraduate nurses. In a typical nursing curriculum, you would cover content that is specific to adult health, care of the maternal child or mother baby, care of the well woman, as I mentioned, the geriatric patient, and of course the mental health patient. So we really have tried to develop a simulation or a immersive experience in each of those areas, in each of those uh, curricular areas, if you will. So if you're in nursing education or you're a nursing educator, you can really identify content that is available to supplement your didactic content or your classroom content, if you will, or perhaps supplement your simulation content. Um, so what we're seeing now is that content can replace clinical experiences. And when you consider that with COVID-19 and the pandemic, many schools of nursing were really forced to pivot or to remove students from the clinical setting. And this was very unfortunate, um, especially in those hospital settings due to surges in COVID-19. The last thing you want is novice nursing students potentially exposing themselves to COVID-19 if they really weren't sure of the ramifications and not how to care for those patients. So what happened? All of these nursing students who would be benefiting from that hands-on bedside clinical experience were forced to go back to class, back to the simulation lab. So those nursing educators were left with looking for opportunities to provide their students with clinical replacement, right? So many turn to Sentinel U. Our products provide that standardized, reproducible, dedicated experience. And that is very important. I don't think people think about this enough, Plamina. If you think, I sent my nursing student to a clinical setting, and in any given day, you can have 12 students in the clinical setting, and each student will have a very, very different experience because humans are diverse and the experiences will vary. But think about it. What if there was something that you wanted every student to experience, to really understand and recognize the concepts that were so important? So if you provide them with a simulation experience, that immersive experience, you get standardized, everybody experiences the same thing, reproducible. And when I say reproducible, that is one of the tenets of simulation, the ability to go and do it again, right? To try to make it better, to perform better, to learn more. And guess what? all along the way, you are not jeopardizing patient safety. You can reset and there's no harm, there's no foul. So my point is you don't necessarily need to be in a unit. You can use these virtual simulations to supplement that clinical experience. As a matter of fact, it is. So, as I mentioned, across different curricular or just in concepts, we are also unique that we have an inpatient setting, we have an outpatient setting. As I mentioned, we have the home-based setting. And one of our products that we really haven't talked about, and we will talk about in depth, I think I'll probably mention it later on, is Sentinel City. Sentinel City is a community health population-based product where you are in the community with your community, really understanding what are the issues that affect that community at large. So yes, we even have in our Sentinel City, we have an assisted living facility. So you can really kind of engage and understand what are the things that are important for senior care, if you will, right? We even have a simulation where you are in a family home, literally doing a assessment of a lower income, perhaps underrepresented individual, and really understanding when I enter this individual's home as a community health nurse, what are some of the things that I should be thinking about? Are there safety issues? Is there food insecurity? Are there hazards? All of that is, up to your point, in those different settings, because we know nurses work in many different settings. I think sometimes we forget hospital-based care is probably one of the largest employers, but we have so many nurses in the community, in corporations, doing all kinds of different things, nursing quality indicators, for instance. So yes, we do accommodate for different settings. That's probably the most intriguing question. Um, And that has to do with any type of virtual simulation or any type of simulation that you provide for your learners. You know, Sentinel U does differ from a traditional hands-on approach in that our products are virtual, right? We are in a virtual environment. In the typical nursing curriculum, you're going to have a didactic classroom content, so sitting in the chair, if you will, and then it's probably going to be added to a skills laboratory experience where the nursing students would practice taking blood pressure, giving injections, or perhaps inserting a urinary catheter. So that's really those psychomotor skills that are so important to learn, and that is a component of itself. But fast forward to more recent times, when nursing educators started using simulation, this provided a great opportunity to kind of close the gap between what they're learning in the classroom, what they were learning in the skills lab, before they actually laid hands on a patient in the actual clinical. So if you think about 20 years ago, we had the seminal report from the Institute of Medicine, and they recognized that we can no longer enter a clinical center, a clinical setting, if you will, never having touched or performed a particular procedure on a mannequin or in a virtual environment. It is unacceptable. So simulation provides that enhanced realism. It offers the opportunity to go in and know that if I make that mistake, like we talked about, that reproducible experience, there's no injury to the patient. So I get to repeat it. And that in itself is enhances my confidence as a learner. I get to work with this patient to fine tune those skills. So at its very basic, the goal of simulation is to ensure patient safety. Um, so the hands-on approach, and by that I think you're referring to that clinical approach, will never go away. Absolutely not. Nurses care for patients. patients are live human beings. They are in beds. They are vulnerable. We will always have to go in, touch, feel, and really have that human experience. Absolutely. That's never going to go away. But what we can do is really prepare those nurses to feel more confident, more competent before they actually lay hands on that patient. When I was a nursing student, we did not have any simulation. We did not have any high fidelity mannequins. And when we went to the clinical setting and we went and touched our patient, I can honestly say I had never touched a human prior to, and I was really doing some high level skills. I was putting needles in them, I was putting tubes in them, and kind of figuring it out as I went along. Granted, I had my faculty there assisting me, but imagine never having practiced this in this virtual environment. It, you know, it is no longer acceptable to use the patients in that practice environment. So we're just really helping them, preparing them, improving that competence, that confidence, so that when they actually go and touch the patient, we can ensure that they are safe, right? And that they are not going to contribute to any negative patient outcomes. Um, so I think that's we are, when we think about virtual simulations, ours or anybody's, we're really looking at a way to kind of close that gap to really enhance that critical thinking, those clinical outcomes. We're trying to provide them with enhanced content, perhaps in a virtual asynchronous environment. So we're just another, what do they call it? Arrow in the quiver or weapon in the arsenal, another piece of equipment to enhance your learner's experience. And we recognize that all learners are different. Some learners intrinsically love to listen to lecture or take hundreds and copious notes. They gain a lot out of it. Some of them are very kinesthetic. They like that hands-on. And some perhaps work very well in that virtual environment on their own, if you will. Maybe they're the introvert, and being in that asynchronous remote environment allows them to really think deeper and have that opportunity. It's just them against the computer, if you will. So it's important that as nurse educators, we recognize that and we really try to approach the learning with our students from multiple facets. So Sentinel U provides that content for the educator to really enhance, accentuate their curriculum, just to ensure that learners are learning the content and we're helping deliver it from multiple avenues, multiple facets. You can learn it in many different ways. One of the things we do with our Sentinel U products is, for instance, if there's a concept that your learners are struggling with, and so maybe you provide that content in a prioritization of care, let's say prioritization of care pediatrics, and then maybe you want to scaffold that content and maybe introduce your students to telehealth for the pediatric patient. So the content is pediatrics, but you're really helping them see it through more than one lens in both a inpatient setting, an outpatient setting, or perhaps in that telehealth environment. Yes, I'd love to. So I do want to mention what you said about learning in a book. It is no longer good practice to just have the students pore over those very dense textbooks. That isn't even what we as educators should be espousing, right? We want that experiential learning. That is where the learning occurs, the ability to think and then think beyond and how will I apply? And that really is one of those adult learning theories where we're looking at that self-made experience, which dovetails very nice with these virtual simulations that we develop. So every single thing we do at Sentinel U is evidence-based. We spend a large amount of time identifying what is the content and what are the learning outcomes? So from a very basic pedagogical standpoint, we always start with the learning outcomes, right? We don't start at the end, we start at the beginning. What do we want our learners to achieve? And because they're simulations, we're also very invested in the Anaxel healthcare standards of best practice and really what is good simulation design. So we spent a lot of time thinking about the best way to present the content. We start with the what are the goals, as I mentioned. And then we decide what is the best way to approach that learning outcome. Is it identifying patients, then that prioritization of care simulation? Is it caring for that patient in a telehealth environment? Now, once that's done, we create these very robust templates and we seek out very knowledgeable subject matter experts in the field. We're looking for nurses who are working at the bedside, right? Who can really contribute to that real world experience. We certainly don't want to make cases that are like, this is not applicable, Laura, or this does not make sense, or this is not what's going on in the clinical setting. That is not how we set out to create these cases. So we really work to make these real world profiles, that real experience that we know that these nursing learners are going to experience. So for instance, in the prioritization of care simulation, one of the things you'll notice is that every single intervention that the learner is going to choose on is based on evidence. There are references to support the decision. So when the nurse learner goes in, we provide them with those references. We provide them with the glossary. We really make sure that they're getting the feedback that they can go on and perhaps look at their own content, their own work, their own textbooks, wherever their resources are. So for instance, if you make a mistake in a virtual simulation, you have an opportunity to redo. You have an opportunity to fix. And if you make that mistake, immediately you're going to get that feedback saying, this was the incorrect choice, and this is why it's incorrect, right? This is what the research suggests. Likewise, when you make a decision, we know, Plamina, that sometimes learners can make the right decision for the wrong reason. And unfortunately, that is not going to be helpful in the long run. So we'll ask that learner, okay, you've chosen the right decision or you've made this decision. Why? What is it based on? What is your rationale? So you have that opportunity to really think and to really do a deep dive. Do I know what I'm talking about? Does this make sense? So all along the way, we're giving the learner that very important feedback. We want them to feel comfortable that what they're doing for the patient is based on evidence. So when we think about the algorithm, it's making a decision, getting that immediate feedback, and why it is correct and why. Or if that was not the correct answer, then why? And that really helps solidify the learning process and really closes the loop, the learning loop. So another opportunity for success is that we provide every learner a comprehensive assessment upon completion of the simulation. That assessment they can use for their own self-reflection. They can share it with their faculty can view it, and it allows not only the learner to reflect on their performance and where they can improve, but it also helps the faculty to identify areas that perhaps need to be enhanced in the curriculum. For instance, if you look across your student body and you notice through the aggregate data that, my students are not doing well in diabetes, or they really are struggling in neurological assessment, I then can go back, I can talk to my curriculum committee, and we can say, look, we have evidence to suggest our students are lacking in these domains. Then I can go back and I can enhance my lecture or maybe make some tweaks to the curriculum. So the assessment data really helps reinforce and helps to drive the decisions in the curriculum. So I think that is very valuable. So they can focus on those areas perhaps that the learner may need a little more uplifting, especially on end of semester examinations or licensing. I don't think we can have enough data points when we're looking at our student performance. That really does help drive those curricular decisions. Great question. So at this time, our content has been predominantly used in the undergraduate or pre-licensure arena. However, our content is suitable for graduate nurses. We are right now embarking on a big advanced practice series that will be used in academia, but these are already licensed nurses that are working to understand the complexities of advanced practice care. Now, we also have hospitals that are using our products for transition to practice, residency, or onboarding. And I think you would agree that just because you graduate from nursing school, pass your licensing exam, get that license, that doesn't automatically make you this magical professional, astute nurse, right? There is a huge transition period from the moment you graduate, get that license, and actually begin working. So our products are also helpful in that setting to really help bridge the gap from that new grad to that comfortable or competent nurse on the unit. They can be used to help those nurses really solidify critical thinking, prioritization of care, especially if they're going to a unit they're not familiar with. So maybe the new grad got an awesome job in labor and delivery, and they're not that sure about it. This is new to them, but they're very excited. So a product such as the prioritization of care prioritization series, they can experience the antepartum, intrapartum, and postpartum cases that really may help them get that added advantage, that individual understanding about the most current, probably the most common occurrences in that environment. So that's a real bonus. So we have hospitals throughout the nation that actually use this content to kind of bridge that gap. We also have two unique products. One is patient management and delegation. Now, patient management and delegation is just that, the ability to look at your unit. So I would expect a more seasoned nurse, right? The ability to look at your unit and decide, where am I going to assign these patients? Who has the skill set to care for these patients? So it's really looking at resources among your unit. So that is for a much more advanced nurse. And then the other product, which I think is very, very unique, is nursing quality indicator. In the undergraduate curriculum, we touch on nursing quality indicator, but it's not until you've been working on the unit and perhaps are in a managerial position that you may be asked to really reflect on the nursing quality indicators. And by that, I mean, and not to get too technical, like 30-day readmission rate. That's a huge metric that we look at. What about the incidence of central line infection rates, or the incident of catheter-acquired urinary tract infection? So now we're taking a deeper dive into the cost, the resources, the patient outcomes. So it's shifted from caring for the patient, but now looking at, now that I've cared for this patient, making sure that the outcomes are positive for the patient. So we really believe that our products do apply to that in-hospital patient setting. And it gives the opportunity to the employer to see how well their new hires are doing, right? If you're thinking about that, do they need a little remediation? Do they need a little bit more support before they enter that new position? Perhaps they need to extend their orientation period. So there's a lot of ways that our products can be used, both in pre-licensure nursing as well as hospital. Now, one thing I do want to mention is that we have recently embarked on an upgrade and an update to our Sentinel City. Um, and we recognize, and this is interesting, you'll think this is interesting. This came about unsolicited. We had a group of social workers come to us and say, your product is very much aligned with social work, healthcare, healthcare educator competencies. Now, this really was not even in our It wasn't even on our agenda. We weren't thinking about it. But when we realized that this community health, population health product really was useful across other disciplines, we realized we had an amazing thing going on. So we spent a lot of time working with social work subject matter experts and health educators to really align our content. So when you talk about are our products interprofessional, I would say without a doubt our Sentinel City, Sentinel Town can be used across multiple professions. So at this time, Sentinel U has been, when I say Sentinel U, our products have been used predominantly in the United States. However, we do have Sentinel City, Canada. We partnered with the universities in Canada, and with input from academicians, faculty, and stakeholders, they were able to come up with a Canadian version that was created that speaks to healthcare issues, social determinants of health, concepts that are important to the Canadian community, including Indigenous or First People of Canada. We're very proud of that product. It's extremely popular product. So imagine looking at a community or population health, but from the lens of the Canadian demographic, if you will. But I am remiss. I would be remiss if I really didn't tell you a little bit more about Sentinel U and how Sentinel City came about. So Sentinel U began. It started as an idea at a nursing school, American Sentinel College School of Nursing. And they had an idea to create some type of virtual assets that could help nurses gain competencies exclusively in community health and population health. Now, this was a little idea, a little tiny seed that was planted among the nursing school and the faculty. And from that idea, the first Sentinel City version 3 was envisioned, articulated, and crystallized. That became the flagship product. Now, in Sentinel City, you as the learner enter this immersive typical city. It's modeled after a small city in the United States. And in that city, there were several different subdivisions or areas that have different incomes. It had a low income area, a medium, high, and all of these areas had also had different demographics. So just thinking about where you live and you think about the cosmopolitan and the wide breadth of demographics where you live within, let's say, 50 miles. So as Sentinel City evolved, it became an opportunity for the learner to go into this virtual environment and to experience what it's like to be in a lower socioeconomic environment where they have depleted or limited resources. They could meet individuals, they could meet key informants, citizens who live in the particular community, and find out what are the issues that are important to them. And so, as a community health nurse, as a community health worker, you're called to really take a stand and say, these things I would focus on if this was my community. So, they come up with a community nursing diagnosis. And this is international. I mean, we know community workers enter communities and really do an assessment. What can I bring to this community to see that it is thriving, to see that it's successful? And that's really what Sentinel City does. It is really kind of all encompassing. And one of the amazing things I think is that you have these key informants and they give you that deeper understanding, that qualitative aspect of what it's like to live within this particular community. And you also get to know perhaps the informal leaders that give you insight into the community at large. So the Sentinel City product has become very popular. And as I mentioned, we're now in version 5. It's been newly envisioned. It's a beautiful product, and the graphics are just gorgeous. And we have a considerable amount of data. Now, the data sets are all unique. They are real data, so it's not like we created a bunch of fictitious data and put it in a graph. No, we've actually used subject matter experts who went out and found real sourced data that can be referenced. So it's there to help the learner gain insight. For instance, what is the incidence of intimate partner violence within this particular community? What is the incidence of food scarcity or food insecurity in this particular community? That's the type of data found in Sentinel City. So you're working with a myriad of activities. And so one of the things that we've done is we've been able to harness and put together all of these amazing activities for the learners. They can literally and actually get on a bus within the city and ride through it and do an actual windshield survey. And that was the impetus for this product. As a community health nurse, getting boots on the ground into a particular community, it's not always easy for the learners, for the nursing students. So imagine providing them with this beautiful virtual environment. So it is kind of one of a kind, and it was specifically created with all of this content, resources, and assets, if you will. So getting back to the question about the use of our products, at this time, 2022, the products are in English. There is some French commentary in the Sentinel City V5. We do have people in the islands of Jamaica and in the Caribbean using the products. So I would say that if the curriculum is in English, I would say certainly the prioritization of care products could be used. I also respect and recognize that there are nuances internationally that may impact the delivery of care, if you will, across our globe. So that would also have to be considered. But I definitely see there is applicability. They are not meant to be America-centric. I would love to see interest. We would always look to partner with individuals to, let's say, as you mentioned earlier, imagine having a UK version that really speaks to delivery of healthcare within the United Kingdom or South Africa or perhaps in Asia. So as far as I'm concerned, I would love to see that. I mean, we're always looking to expand and to engage with really creative individuals. Well, for Sentinel City, Canada, that I say would took over a year because if you can imagine understanding how communities work within a certain demographic takes amount of time because you want to do it justice. You want to make sure that what you're representing in this virtual environment is actual, factual, and based on evidence. So that's not something you would rush into. So, but prioritization of care, something that I would do, I would sit down with nurses in Ireland, with England, and with South Africa, with in Nigeria, and I'd say, what is the scope and the role of the nurse in these particular countries? Because they do vary, they do differ, and then you'd have to kind of put together. In some countries they work very specifically with uh, uh, what we call guidelines, if you will. So maybe there's not as much autonomy, or perhaps the scope of care might vary. Maybe they have a lot more autonomy that we've even accounted for in this particular product. So those things are super important. You know, um, but it's definitely worth it, experiencing and exploring. In some countries, they still haven't moved into the advanced practice role. So maybe the advanced practice series would not be as appropriate. But at the end, to make a product that is robust and really speaks to the nurses within a particular country, it's so important to have their perspective. I wouldn't venture or even dare say I understand nursing in another country until I've had an opportunity to meet with those nurses and really understand how they deliver care. And even on a national level, what is the national health care system like? All of that would impact how we would develop a product. So I guess our entire conversation today, talking about virtual simulations, brings us to this point. So if we go back to the original premise of what is simulation, simulation is the recreation as near as possible of an event, a scenario, a patient encounter. We're trying to make an authentic encounter where the learner can enter in, suspend disbelief, and really try to care for this patient. Now, novice learners are going to make mistakes. We don't want them to make mistakes at the bedside where there are potentially life-threatening situations that can result with negative patient outcomes. We want them to make mistakes within our products. That is what they're there for. I can make a mistake. I can order the wrong medication, the wrong therapeutic. I can prioritize incorrectly, but I can get feedback and I can practice and I can do it again. I can reflect on the feedback, right? I can do better, implement changes that I think are important. And that's how we are promoting patient care and patient safety. There's no excuse for just putting that nurse directly in a clinical setting without having had these experiences in advance of that experience. This is how you ensure patient safety and patient care. As a matter of fact, I do. We are seeing, if you think about the professions such as anesthesia, medicine, even dentistry, there is a move towards really being able to successfully demonstrate competence even before moving into the patient, the real life patient. It is now being included in high stakes summative testing. Think about that. Not only are you going to take a written exam, but we're going to put you in a scenario where you need to demonstrate those competencies before we let you loose on a real live human being. In addition, nurses, physicians, any healthcare individuals are required to maintain their license. And part of that licensure can be in the form of resitting for an examination. But what we're seeing more and more is that these individuals are going to have to come back. They're going to have to sit and participate in an experiential simulation, whether it be virtual or high fidelity. Again, demonstrating competence, not only demonstrating competence, but demonstrating retention, right? Retention. Oftentimes you can be in what we call, where we see this very important feature of simulation is what we refer to as high risk, low volume situations. If you think about some high risk would be, no one ever wants to have a patient, for instance, that is a postpartum hemorrhage. Now, worldwide, postpartum hemorrhage accounts for a large number of women during childbirth. No one expects to see a postpartum hemorrhage. Everybody prepares and anticipates it. But when it happens, so that's why it's a low risk event, but it is a high risk. I mean, it's a low volume event, but it's high risk, which means when you see it and you don't know how to care for it, your patient may die. The same thing holds true for cardiac arrest. We don't want to see cardiac arrest. We try to mitigate that by being vigilant, by, making sure we're checking on our patient. So again, it is a low volume, high risk event. If it happens, there could be a negative outcome. So those types of things are what you want to make sure that you're continuously exposing your competent, seasoned, licensed nurses and healthcare professionals. Everybody could use those refreshers. Yeah, they are doing simulation training. In fact, to be honest with you, medicine has really embraced simulation because they also recognize that this is the way to train for mastery, to really help these medical students and these graduate medical students how to improve their competencies. That's why we have robotic surgery. You just don't show up. They spend countless hours in a simulated environment getting it right again and again and again. So healthcare, as I mentioned with the Institute of Medicine, um, you know, we cannot afford errors, patient errors. So we have to safeguard our patients, like you said. And in order to safeguard our patients, we as healthcare providers need to continuously practice, immerse ourselves, better ourselves, learn new techniques in this immersive simulated environment. Many hospitals have what they refer to as in situ simulation. So that is the immediate simulation. Everybody needs to come. They put a mannequin in the middle of the room. This is our patient. Everybody needs to participate. They're working on their team building skills, and they're taking care of that simulated experience right then and there. So this is not going away. What we are seeing is more and more sophisticated simulations, if you will. So I'm just talking about 2D, right? But now we're also working in a virtual reality or augmented reality. We're going to see, I expect within the next 3 to 5 years, everybody is going to be wearing those head goggles, right? The head mounted displays, and they're going to be in this immersive virtual environment that looks just like an OR, that they can care for their patient in the OR or in the critical care setting, or at a car accident, right? A motor vehicle accident. This is the future. We just need to continue to grow and understand what best practice is. We do have a lot of testimonials from our users on our website, predominantly faculty from throughout the nation that have used our product and seen a difference in their students' performance and on standardized exams. But the one thing that I want to share that I think is unique and super important to mention at this time, we know nursing education relies heavily on evidence-based practice. And with that in mind, we've got to be able to generate data to support our learners and our learning outcomes. So one of the things I embarked upon when I joined Sentinel U was to create a Sentinel U nursing research grant. It's been highly successful. We've had numerous applicants with unique research proposals. And I really wanted to understand what were the things that they wanted to understand and how can we as Sentinel U fit into that and help them achieve it. So we received numerous proposals. We had a review committee look at them and rank them. And we were able to offer in-kind product for the duration of their study. And this is an opportunity for me to give these products to these individuals with these incredible, unique ideas and allow them to study our content, our products, and then hopefully generate those outcomes. That data that is so important to help drive decisions on whether to use virtual products and how do we best fit in the curriculum. So 2022, January, that is happening right now. I've got 7 schools that are starting their research studies. I'm really excited about this, and I hope within the next year I'll be able to share this data in the form of publications with the simulation community at large. And we really will be able to cement our place among the virtual reality simulation products that are out there. So I like to add in closing that, in addition to Sentinel U website and social media platforms, I would recommend nurses also take a look at some of the other videos on the Voice of Nursing channel. They're quite insightful about a range of topics, and it makes me really happy to be a part of it. I am so thrilled to have been invited. So thank you for having me. It was a pleasure. I really enjoyed it. And, you know, first of all, as president-elect of ANAXL, it's an international nursing association. So I am very, very aware of the global nursing simulation community. So it's very exciting, to be quite honest with you. And so much goes on in Europe and the UK and South Africa and Australia. So to be able to reach those communities, it's thrilling.